we're going to talk about retractors and their use. When we're using retractors, we're trying to get the tissues around the teeth out of the way so that we can get whichever image we're trying to get. There are two types of retractors that you can use, an all-metal retractor or an all-plastic retractor. They work equally well. Which one you choose is entirely dependent on which one seems to work better for you. I really would suggest that you buy both kinds. They're not expensive, and you can experiment and find the one that works best in your practice. So at the end of this lesson, you should be able to identify how to place retractors, how to make sure the patient is comfortable, and how to get maximum exposure inside the mouth for your photographs. Let's start with the metal retractors. Before we put any retractors in our patient's mouth, we want to make sure that they're as comfortable as possible. We're going to be stretching these sensitive tissues. So I've got a little cotton pledget here, a Q-tip with some Vaseline on it, and I'm going to give it to Scott and let him spread it around his lips. And that just helps lubricate the retractors and will help keep him comfortable. Now, because Scott's pretty good sized and doesn't have a very small mouth as we might find in some women, we're going to start with the larger ends on the metal retractors. So I'm going to have him open just a little bit, and I'm going to slide the retractor in over his lower lip, and then I'm just going to rotate it. And I'm going to ask him to reach up and take the end of that retractor. I give the retractors to the patient because frequently they will pull much harder and do a better job of getting the lips out of the way than I would or my assistant might. We're concerned about hurting the patients, and they can actually feel how much they're pulling. So we'll slide this one in the same way. And now, Scott, if you turn towards me just a little. Now, I'm going to take the retractors. You can let go. What I'd like you to do is bite your teeth together. Now, if I pull these retractors up against his face, and that is frequently what people want to do, it doesn't get the tissue, it doesn't get his lips and his cheeks away from the teeth. So if I pull the retractors out, and on the metal retractors, if I actually dig the ends into his cheeks, if you will, and pull, notice how I get the cheek tissue all the way away from the teeth. It opens up all the way back to the second molars. And then we'll release. Now, how we use these for specific shots will be illustrated as we show you how to do each of the individual images in subsequent lessons. If we're going to use a plastic retractor, it works really exactly the same way. I'm going to take this corner of the retractor and I'm going to place it in the corner of Scott's mouth, and I'm just going to roll it into place. Would you take that, please, Scott? And then I'm going to take this corner of the retractor and roll it in this way. Now, Scott, if you'd bite your teeth together, go ahead and take this retractor. Now, I'd like you to pull out and straight forward as far as you can. Now, with the plastic retractors, you can sometimes get a wider oval than you can with the metal retractors. The most important thing I'm trying to do with any retraction is keep this area of the lip from bowing down and getting in the way of the teeth. Now, notice how much space there is here on these buccal corridors. And the reason we've got that space is I've had Scott pull forward. If he only pulls out, go ahead and go back so they can see. Go straight up against your face now. See what happens to the lips? They line up against the tissue instead of being away from the teeth, and the space back here closes down considerably. Okay, you can take those out. Thank you. So, as I said, in this lesson, we've demonstrated how to use metal and plastic retractors, how to have your patient help you with those retractors, and how to place the retractors so that the lips and cheeks are as far away from the teeth as possible. Thanks.